The morning of July 9th, 2011, I went to get Seth up, just like any other morning. And when I found him in his crib, he kind of looked catatonic. It took a good 3-4 days before the doctors had an idea of what was going on with him. They tested him for everything. We figured out that what he had was called acute disseminated encephalomyelitis because of the areas of the brain that were damaged. In Seth's case, he has a lot of behavioral characteristics that are consistent with autism. So he has been diagnosed with autism spectrum disorder. It's been hard. Honestly, I figured since I work in the system, and I know it really well, I've worked in the children's system for quite a while. I was like, oh, this will be a breeze navigating and knowing what services there are. And it is not as easy as I thought it would be, although I know that I'm doing better than, say, somebody who has no experience with it. Even though he has the autism diagnosis, it doesn't fit in all areas. So there were a lot of kind of things that typical kids with autism respond to that he wasn't. And so I just wanted to kind of figure out who he was now. I now am in the community as a justice liaison, and I oversee our justice traumatic brain injury program that we've built from the ground level, screening individuals for brain injury and working with their providers to make sure that they get the right services that accommodate the needs of their brain injury, and understanding that while their symptoms might present in one way, they aren't necessarily the traditional diagnosis that you would give, and maybe that treatment is not appropriate. All the while doing that, I've been working with my son's psychiatrist and his treatment team to educate them, and they've been really receptive. Understanding that, okay, we might not treat him as we would a typical child with autism. I went to the emergency room before work one Monday because I thought I had Bell's palsy. However, after the doctors reviewed my scans, they determined that I should go see a neurologist who specializes in multiple sclerosis. They found multiple lesions on my brain that were consistent with MS. Now I have kind of, I guess, the trifecta of understanding of, disabilities and having to navigate the healthcare system as a professional, as a parent, and now as a patient myself. There's a purpose in all of it, so there's nothing that I'm doing in my life that doesn't have meaning for me at a really deep personal level. I have an amazing support system. I have a husband who is incredible and understands that sometimes I just need to have a break. Sometimes I need to go lay down and have a nap, or I need quiet time to study. I'm lucky to have the leadership and colleagues on my team at Arizona Complete Health that I do, because they've all been really supportive. If I need to take some time off because I'm not feeling great, they're always right there to help out with anything. I think it's important to know that we're peers, that we're family members of individuals in the system, that we're in the system ourselves. We don't just make up programs because we think that's what we want to see, that's what we want to do. We do it because we have our own experiences, and we learn about the experiences of our membership, and we can combine those to create these really strong programs for them. I want our members and the community that we serve to know that there is a personal passion for what we do. A lot of us have been there or are there, and we just want to do right by our community and do the best that we can to help them.